Hello and welcome to Senior Soundwaves radio show sponsored by Visiting Angels. This is the show where we help seniors and their loved ones be in the know. We discuss some of the issues that affect our seniors and some practical solutions to the challenges they face. I'm Matt Thompson, and I'm so happy you're with us today.
Good morning. You are listening to the latest edition of Senior Soundwaves, sponsored by Visiting Angels. I am Yadira, the Client Care Liaison, and today I have Alyssa Sommerfeld with the ADRC of Fond du Lac.
Well, thank you, Yadira, for having me today. It's always great to come talk on Senior Soundwaves and let everyone know what the ADRC does and what my position, Dementia Care Specialist, does.
Yes, welcome back. So, Alyssa, tell us a little bit about yourself and what led you to work with the ADRC.
Well, of course. So, I have a background in public health. I went to the University of Wisconsin-La Crosse for a bachelor's degree in community health education. And before working for the ADRC, I actually worked for the Alzheimer's Association over 2 years. I was community outreach coordinator for Fond du Lac and Dodge County. So I did a lot of education in the communities, and I met with families, provided support and resources. But then they did a little downsizing, and then the position for the Fond du Lac County Dementia Care Specialist came about. I am actually the first one for our county, which is really exciting. Every county in the state of Wisconsin has a dementia care specialist. It's just, unfortunately, Fond du Lac County was one of the last counties to be granted one. So That's how my position came about. And since I had a lot of experience and knew the area already, I got this lovely position, and it is a lot of education and support like I did before at the Alzheimer's Association.
Yes, awesome. And I hear that you are doing great things out there. So it's awesome that the team has you there with that position being fairly new and you're taking it on really well. So for those listening and that may not be familiar with the ADRC, what exactly is the ADRC, Alyssa?
Sure. So the ADRC stands for Aging and Disability Resource Center. Like I said, in every county in Wisconsin, there is an Aging and Disability Resource Center, and it provides resources and support for community members that have a disability or are in that aging population. So like I said, my position is a dementia care specialist, but other positions at the ADRC are information and intake social workers, and we also have adult protective services. We have our aging unit, which helps with getting transportation for that older population. Also, our nutrition department, so they do a lot of Meals on Wheels and coordinating with the meal sites. We have our caregiver specialist, so she heads up our National Family Caregiver Grant Program and the Alzheimer's Family Caregiver Grant Program. And then we also have a prevention coordinator. She does a lot of classes such as Stepping On in Mind Over Matter, which is a bladder control education class. So those are a little bit of the things that we provide for, information, support, and education at the ADRC.
Yes, those are wonderful programs. So with that being said, so who should all be calling the ADRC? Is it just for seniors?
So people who are working with seniors can definitely reach out to us, family members, friends, even professionals, just to get an idea of what we're offering for resources. So you don't have to have a disability or be a senior to reach out to us. It's good to just come in and chat and see what we have to offer.
Awesome. And what are the most common reasons people do reach out to you?
A lot of the time it is to find care options or, funding when you are aging and maybe you are going to have to move to a facility or a family member needs to move to a facility. Also, our Adult Protective Services Department, they get a lot of calls, which is unfortunate, but at the same time great that we have those people for the community to work with the police and law enforcement. Our EMS team works with them a lot. So they're very busy. And then also we have an elder benefits specialist and disability benefits specialist, which they get a lot of calls, especially around the Medicare season time.
Oh, yeah.
Yeah.
And that's awesome, though, that all these different entities can all work together for our seniors. So as far as the ADRC and their services, is there a cost for the services there? And how can someone get started getting that assistance or services?
Sure. So All of our services really are free. Like all the programming I offer is free, and that's great because a lot of times people are worried about like, okay, what is the cost going to be if I utilize something? Yes. Our services are free because we're really guiding you to what resources are out there. So then maybe those resources aren't going to be free, but we can at least give you information on what's out there. And to get a hold of us, we obviously have a great, easy phone number to call, 920-929-3466, or you can visit the ADRC website. So you just go to Fond du Lac County, type that into Google, and the ADRC tab's right at the top. So you can find that information. As in location-wise, we also have walk-ins. We did recently move last June, July-ish. We were on Portland Street, downtown Fond du Lac. Now we are in the old UW-Oshkosh or Fond du Lac campus building. So that is 400 University Drive. And our building actually faces the soccer fields if you're familiar with the location. We're under the blue Human Services sign. So we have a great new building, lots of great conference rooms. Awesome. But if you aren't familiar where that location is, it can be a little confusing. We have a lot of great signage out there now to help direct people.
Yes, awesome. I am familiar with the fields there, so that's a good field mark there for you to let us know. And it is really just facing the fields.
Yep.
You might feel like you're not getting to it, but you will.
Yep, you'll find us.
You'll find it. It is very nice. Okay, well, as far as different programs that the ADRC does help serve or coordinate for our seniors, what is it that you have available now or coming up?
Of course.
Yes.
So I always have some great education programs coming up through the year. One that is actually starting in April, and we try to do this at least twice a year, is our Powerful Tools for Caregivers class. So this is a 6-week course. It's for any type of caregiver. It doesn't have to be a caregiver that's taking care of someone with dementia. So that's great. It's open to anyone. It is, again, a free class. This session, we're going to be holding it at the Fond du Lac Public Library. And the class really covers how to just take care of yourself as a caregiver. So really focusing on the self-care, because as a caregiver, if you're not healthy, you're not caring for yourself, you can't care for your loved one as well.
Oh, yes.
So it's a great class for caregivers. And then I have a Booster Brain and Memory class coming up in May, and that will be at the Fond du Lac Senior Center. But this class is just a general overview of how to help our brain and body and just be healthier. We do hit a little bit on what dementia is, but you don't need to have a dementia diagnosis or know anyone with a diagnosis to attend the class, because really it's just learning how to take care of your mind, your brain, your body, because we know that what's good for our heart is also good for our brains. So those are 2 classes I'm doing that are coming up. But this year we also have a great partnership with the Wisconsin Alzheimer's and Disease Research Center out of UW-Madison. And we are going to be a host site at the ADRC for their Healthy Living with Mild Cognitive Impairment Education Series. That was a long title. Oh. But they come up with different topics throughout the year and have speakers that are professors or doctors and talk on specific topics related to the brain. And the first one's actually coming up March 6th, so this next week on Friday. And it's actually talking about unpacking ultra-processed foods and how that affects our brain. So very interesting topic.
Very.
You know, people want to be healthy, but sometimes they don't realize if a healthy food is marked healthy, it may not be great for us and not great for our brain. So it'll be very interesting to hear what Beth Olson, the doctor who's talking on this topic, has to say about it. So we're excited for that.
Where would we be able to find that information for this event?
Of course. So this event information is going to be on the ADRC website. Okay. Otherwise, people can call my direct number, which is 920-929-3419 to get more information on it. And this is a series that will be going throughout the rest of the year. It'll always happen on a Friday. It's not every month. It's every 3 months, I believe they have.
Well, for those that are just now tuning in, we are here with Alyssa from the ADRC. just sharing about those wonderful resources that are out here and available. Alyssa, so the ADRC, the programs and everything that you are now describing, this is similar to other counties, correct? Would they be able to find similar programs like this? The wonderful support that you have for our caregivers, all of this would be in other counties, correct?
Correct. There is a dementia care specialist in every county, and every ADRC pretty much covers the same type of programming and has the same type of positions. So you would definitely be able to find the same things throughout the state.
Well, one last question before I believe we do go on break. How does the ADRC help families who are feeling overwhelmed caring for a loved one? So additionally, from these programs that you have available, what else does the ADRC do to help guide and care for these?
We're available to meet one-on-one, and I think that's the most important thing. I meet with families all the time, and it helps them know there's someone there to support them in person and just have them talk to someone else. Sometimes I feel like a counselor, which is not a bad thing because these family members need support and need to talk to someone. Sometimes they don't have someone else to talk to about these issues. So it is really important, and our information assistant social workers do the same thing. So it's a great service just to have for support of others.
Absolutely. Communication is key. They want to be heard. They want us to understand their struggles. And that is awesome, Alyssa. You guys get to analyze that and see what programs best fits for them. Thank you for that.
You're welcome.
And you're listening to Senior Sound Waves. We will be right back after this break.
Senior Sound Waves is a program developed and sponsored by Visiting Angels. More of our program coming up next.
When the time comes for a helping hand, we're America's choice in home care. When you or your loved ones need assistance, Visiting Angels will be there.
Did you know Visiting Angels offers a Veterans Choice program? Many veterans qualify for VA programs that could result in little or no cost to them. Visiting Angels can help you navigate your options. Some of these programs even extend to the spouse of the veteran. Being the primary caregiver for a loved one is not easy, and oftentimes you don't take time for yourself. Trust Visiting Angels. It can also be just as important to your loved one to spend time with others for mental stimulation. Log on visitingangels.com.
We will design a detailed care plan suitable to your needs. You can stay in your own home and get excellent, comfortable, safe care with Visiting Angels. Check out our website at visitingangels.com.
Visiting Angels, America's choice in home care.
Senior Soundwaves is the show where we help seniors and their loved ones be in the know. Now back to more Senior Soundwaves presented by Visiting Angels.
Welcome back. We are here with Senior Soundwaves, our guest, Alyssa Sommerfeld with the ADRC. We are going to hop right in. So when families want to keep their loved ones at home, Alyssa, how does the ADRC support that goal?
That's a great question.
And our goal, of course.
Right. A great question. And I feel like this is something I definitely talk a lot about with families when they meet with me one-on-one. We help guide them sort of through the process of, financials, if they need to look at getting help paying for it. That's where information assistant social workers definitely come in because they can do a long-term care screening. If funding is needed, we also have the two grant programs I recently mentioned before, the AFCSP, which was that Alzheimer's Family Caregiver Support Program, and the NFCSP, which is the National Family Caregiver Support Program. But then we also give them our ADRC resource guide, which has a listing of all the businesses and organizations that may offer that care. Because as the ADRC, we can't be biased and we can't be, unfortunately, telling people what ones we think would be the best. So our ADRC resource guide is that great tool for families to at least see what's in the area and the contact information for those businesses to utilize. Because having home care is important for the caregiver to take care of themselves, maybe get a little respite, get some groceries, get some errands done, or even go to doctor's appointments themselves,
Yes.
all while knowing that their loved one is being cared for and is safe. So really, we're that guiding point, sort of giving them resources on what to look for, what is out there, and then helping them with financials if they would need that as well.
Okay. When you mention financials, do you guys work with Medicaid aside from those grant programs? Do you guys work with government programs that help offset some of these costs?
Yes, we definitely do. And really that's where those INA, the information and assistance social workers, come in, and they would do that long-term care screening, and they go over that family or person's assets, see what they have, and sort of let them know what they may possibly qualify for. And once they do that long-term care screening, and then they get that sent in, they could possibly get some funding to help pay. Everyone's situation is obviously different, but our INA social workers really help explain to people, the ins and outs of it, because it's not always easy to understand that part.
Oh, yes.
So if you have questions, obviously call the ADRC, and, they can definitely help go through everything with you.
Awesome. And in your experience, Alyssa, what is one benefit or program that people don't realize that they qualify for and end up qualifying, and that's one of the most beneficial ones? So
I think just not knowing in general what programs are out there, not even knowing what the ADRC is,
Yes.
I think is the big part. And, not some of the programs we offer are obviously free for the majority, so you don't need to have any qualifications for it. But I think one of the big ones would be our grant programs. Like I said, the NFCSP and the AFCSP, and actually the Alzheimer's Family Caregiver Support Program. There used to be a income gap, or income, you had to be in a certain amount requirement.
Okay.
And this past year, that was lifted.
Oh.
So that really helps our caregiver support coordinator reach more families and utilize the money that the state grants to give out. So that's really great. But a lot of families don't know about those grant programs. And now that one of those requirements has been lifted for, what assets and funding they already have,
Yes.
it can be really helpful. And that program can help with paying for in-home care, or just little things like if they have to take care of their own lawn and snow removal and they just don't have the time, or they're, getting more frail too, but they're still the caregiver, it can help with paying for those things. Anything that's going to help the person still live and stay in their home safely.
Oh, wow. That is awesome. That is awesome. And I was not aware that their income requirement was lifted. So that is good to know. And I bet it is reaching out way more out there in the community. Hopefully, we can educate more out there, and more are tuning in and listening about these programs, because definitely it's out there and available for you guys. Use it. Reach out to Alyssa. Alyssa, how can the ADRC help veterans in our community? Do you guys work closely with veterans, and what programs may be available to them?
That's a great question as well. So yes, obviously we want to help our veterans, and we have a good relationship with Veteran Services through Fond du Lac County. So we actually used to be housed under the same roof at one point on Portland, so we know the Veteran Services staff very well. But if we get questions that are a little, pertaining more to specifics and with veterans and we don't know it, then we just reach out to Veteran Services. But all of our services, we want to help those veterans just as much as anyone else in the community.
Oh, yes, definitely. Oh, well, now let's see. What advice, Alyssa, would you have or would you give adult children who live out of town but worry about their loved one, those senior parents? Are they reaching out to you as well?
Yes, actually. And sometimes, it's these adult children that live out of state. Usually I get more calls after holidays because, they've been with their parents. Yes. They realize how much maybe that parent is declining and didn't realize it just talking to them over the phone. So after the holidays, I'm pretty busy because of that. But it's important to get started even early just to know what resources are out there. Even if your parents are doing great, we want them to do great for a long time, live in their homes, but just keeping in mind, what resources are out there. I think about my parents even. They're very healthy, very active people, but we are all going to age. That's inevitable. Yes. So just sort of knowing what's out there and being in this position really helps, like thinking of the future, because you just never know what's going to happen, and you don't want to be in a crisis moment and then don't know what to do and have to make a decision, which maybe you wouldn't have made that decision if you had planned in the future.
Yes. And with that, do you think people wait too long to reach out to you?
For the majority, no. There are some instances where that does happen, but I feel like people usually meet with me at the right time, especially if someone just gets diagnosed with dementia, they're reaching out. Okay. And we have good partnerships with the hospitals around the area and the neurologists who are doing diagnosing. I come in and meet with them and at least educate them once a year, say, hey, I have the brochure. Please have people reach out to me after you give a diagnosis because they need more resources than just saying, hey, you have dementia. They want to know what's the next step. What else is out there? What can I do? So getting that education is great, and just having those partnerships too, so people aren't left hanging.
Yes, imagine getting the news of a new diagnosis, and then you having to face everything else alone. So it's wonderful that they have one specific place to go to and learn, whether it's education, support, programs that you have available to them. So that's really great out here in the community. What do you, in your words, what do you think, or how do you feel, if I ask, how does the ADRC in Fond du Lac, how is it unique to others? Do you feel it's different?
I mean, every ADRC is going to be a little different in every county because, every community is different. I would say our community, just like a lot of the ones in Wisconsin, are a little more rural, at least in this side of the state. So people tend to be a little more tight-knit and just, know people out in the community already, not from work. So that's sort of special, People like to refer more maybe because they're comfortable knowing, the person who is in their community. Not saying that any of our other ADRCs in the urban areas are not like that, but I feel like we have a little more connection. Just because we're in a smaller community, which can be nice.
Yeah, I agree. I see that out here too. So a lot of us work very closely together, and so I think that helps out our senior community and just bringing awareness to what is out there for them. So what is one thing that you want every listener to remember about the ADRC, Alyssa?
I would say that we're there to help, and please reach out sooner than later. Our phone number is 920-929-3466. So just remember that number. Remember that we're there to help and support you.
Awesome. Thank you. And if someone is unsure whether they should call you, what would you say to them, Alyssa?
You should probably call me.
Just call. Just call. Well, thank you so much for tuning in. This was Senior Sound Waves, sponsored by Visiting Angels. Thank you, Alyssa, so much for being here with us and sharing all this resourceful information.
Thank you for having me.
Senior Soundwaves is a program developed and sponsored by Visiting Angels, where we help seniors and their loved ones be in the know. Join us next time for another edition of Senior Soundwaves.